Here everyone, today's topic is scalp. Scalp is soft tissue covering cranial vault.
Next we move to extent of scalp. Boundaries of scalp in the anterior aspect starts at the supraorbital margin. Posterior aspect ends at the external occipital protuberance and superior nuchal lines. On each side it includes superior temporal lines.
Scalp is composed of 5 layers. Skin, connective tissue, epicranial aponeurosis, loose areolar tissue, pericranium.
Skin basically consists of hair follicles and sebaceous gland.
The second layer of scalp is connective tissue, and it is dense subcutaneous layer of fat. It mainly contains fibrous tissue. This layer contains nerves, main arteries and main veins of scalp. The third layer is epicranial aponeurosis, which is also known as galea aponeurotica. It is tough tendinous sheath and is part of occipitofrontalis muscle system. It also connects temporalis and auricular muscles laterally. The fourth layer of scalp is made up of loose areolar tissue. It is the common area of infection spreading. This area is known as dangerous area of scalp because the emissary veins which open here may transmit infection from the scalp to cranial venous sinuses. The pericranium is the periosteum of the skull bones which provides nutrition to the bone. It is strongly attached to the cranial sutures.
Now we will talk about the blood supply to scalp. There are 5 main arteries that supply the scalp with blood. They include occipital artery, posterior auricular artery, superficial temporal artery, supraorbital artery, supratrochlear artery. Next, venous drainage of scalp. Venous drainage is very similar to arterial supply of scalp, so they correspond to arteries. They are supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein, occipital vein. So these are the veins which drain scalp. Lymphatic drainage. Anterior part of the scalp drains into preauricular or parotid lymph nodes. The posterior part of scalp drains into posterior auricular or mastoid and occipital lymph nodes. Nerve supply. Scalp is supplied by 5 nerves anterior to auricle and 5 nerves posterior to auricle. They are supratrochlear, supraorbital, zygomaticotemporal, auriculotemporal, great auricular, lesser occipital, greater occipital, third occipital nerve,